Good morning, everyone, and thank you very much for joining us this morning for an update on our moving on plan, and more specifically, step 3 of our plan. To again state the very obvious, it's been a long, hard road to get to where we are now, and a road with many ups and downs and twists and turns, and I think safe to say that not one step of it has been easy for anybody. Over the last few weeks, Dr. Morrison and her team, as they have since the beginning of the pandemic, have been monitoring our island situation very closely. As you all know, that we have seen a consistent and persistent level of positive COVID cases in our province. And while that number is above what we would like to see, the science and data does suggest that the protocols that we've had in place have helped us avoid the dramatic spike in cases that other jurisdictions have dealt with and look to be dealing with in the days ahead. While we continue to balance all aspects of this pandemic, the social, the emotional, the mental aspect of all of this for Islanders, that is why we have tried and I think have succeeded with a slow and methodical walk through this pandemic in a responsible way, in particularly as we make our way through the last components of it. And I know that has meant that Islanders have been asked to do a lot. They've been asked to be responsible. They've been asked to be mindful, and they've asked to be selfless while making sacrifices such as wearing a mask. It hasn't been something that we've all loved to do, I think, to be honest, but it is something that we have essentially embraced, and I think that's because that is who we are as Islanders. We're always out to help others in need. We're always there to care about others, to care about family, friends, and our community and our province in general. We've always tried to do everything that we could do, and we will always try to do anything we can do to help those who need it the most. And I think that really is the spirit of what it is to be an Islander. And throughout our plan, we have witnessed tremendous selflessness by all Islanders, and I'm grateful for that. And as we are moving through our plan and past some of our and many of our protocols, there are some that we will need to continue just a little bit longer. Dr. Morrison has recommended to Provincial Cabinet this morning that our mask mandate for public places remain in effect until April the 28th, and Cabinet has accepted that recommendation. Dr. Morrison has also made a number of other recommendations to Provincial Cabinet, all of which were accepted. Number one being that the state of public health emergency is set to expire at midnight tonight. And for the first time since March 2020, it will not be renewed. All requirements going forward can be and will be done through the powers that Dr. Morrison has through the Public Health Act. A legal order will become effective tonight at midnight that a mandatory masking will continue until April the 28th for indoor places, including schools, hospitals, and other high-risk settings. And B, that those who test positive will be legally required to continue to isolate as has been the case all along. Testing requirements will continue with our schools, and those rapid antigen tests that students are doing 3 times a week will need to continue, and they will continue to be distributed between with students and staff. Our intention is that by the 28th of April, based on the recommendation from Dr. Morrison and her staff and the best science and information they have at the time, that masks will continue to be required in some settings such as hospitals, long-term care, public transit, and other high-risk settings. But all things being equal, that we will hopefully be in a position to move towards the dropping of mandatory and going to strong recommendation for masking and moving past some of those requirements. But as we have done from the very beginning, we will monitor the situation and see where we're at in the days leading up to April 28th to make sure that science and health and the best data will guide our decisions. we are getting to the point, and we've talked about this for a while, where individuals will have to make their own choices. I fully expect that many will continue to mask because, as I said in my opening, that this is something we do. This is something who we are as Islanders. We're always looking out for others. But you know, there will have to come a time where government will not need to mandate these things, and the public responsibility will have to be something that individuals will have to take up, and I know they will. You know, we're not there yet. Dr. Morrison has talked to me over the last number of days about just the need to continue masking and the level of comfort that having the public masking mandate remain in place gives the CPHO table to make the decisions, the other decisions that we are announcing today. Last but not least, I know there are some out there that still haven't gotten their third dose yet. I don't know if this is a scheduling thing, a bit of hesitation, or whatever the factors might be, but I want to tell you, I can speak from personal experience, that it's worth it to have it. It does prevent serious outcomes. It does help you, keep you from getting really, really sick and need to be hospitalized or worse. And although we can still get COVID-19 even after the booster dose, it's a heck of a lot easier on you if you're triple dosed. And I know there's some conversation that Dr. Morrison is having at the national table level about the fourth dose for those as well. And she'll have some more information based on that today. But all of that to say, the mandate for public masking will need to be continued in Prince Edward Island until April the 28th. And while I know some are probably eagerly awaiting the end of that particular protocol, this is something that we need to continue to do in the best interest of all Islanders. And I just would ask Islanders to continue to do as they've done since the beginning of this. And in a few short weeks, we will be through this. But with that, I'll turn it over to Dr. Morrison for a more comprehensive update, and then we'll open the floor to questions from our friends in the media.
Okay. Thank you, Premier. Good morning, and thank you for joining us here in person for some of you as well. We are now into our third year of this global pandemic. In March of 2020, we could never have imagined what COVID-19 would mean for us as individuals, as a province, a country, or really the global impact. The World Health Organization is reporting almost 490 million cases and 6.2 million COVID-related deaths worldwide. COVID-19 has and continues to represent an unprecedented challenge to the health and well-being of the global community. COVID-19 has impacted everyone in P.E.I, and it has been disruptive. Many have had to isolate as cases and close contacts. At times, our loved ones in long-term and community care homes have felt more isolated. We've been separated from family and friends who live off-island. Some individuals, families, and businesses have been negatively impacted financially, and sadly, some families have lost loved ones to COVID-19. This pandemic is not over, and there will continue to be cases and potential future waves related to new variants. The Public Health Agency of Canada has confirmed that a resurgence of COVID-19 is underway in this country and is predicting a fall and winter surge of cases. Future impacts on the healthcare system are expected to be manageable due to the high rate of vaccination and the availability of effective treatments. Canada is in a transition phase in responding to COVID-19. Our response has been strengthened by the availability of vaccines and therapeutics, despite the emergence of more transmissible variants. Like other provinces and territories, P.E.I is in a transition phase as we look to lifting more public health measures tonight at midnight in accordance with the Moving On plan. As I mentioned at the last briefing, transitions are challenging, especially when they're unknowns. We do not know the risk or impact of resurgence of new variants of concern. However, we will be ready to respond. Going forward, we will continue to rely on important tools in our toolbox, including vaccines, therapeutic treatments, public health measures, ongoing surveillance and monitoring, and public health and health care infrastructure. I want to address the issue of our office sharing COVID-19 related information with the public. We have and continue to be open and transparent regarding the situation with the pandemic. Recently, we moved to providing comprehensive weekly reports. This is similar to what is happening in other provinces. I can assure Islanders they will be advised immediately if there's a significant change in the level of risk related to COVID-19 and P.E.I. Otherwise, we'll continue with weekly reporting and be available to respond to media inquiries. Over the last 7 days, there have been 2,576 new cases of COVID-19 and P.E.I., including 401 cases yesterday. Our total active case count is 3,619. Over the last 7 days, we've had an average of 367 cases a day. There are 30 individuals in hospital with COVID-19. 14 of these individuals were admitted due to COVID-19, including 3 in the intensive care unit. And 16 were admitted for other reasons and were COVID positive on or after admission. There has been 1 new death to report in an individual over the age of 80 years. My sympathy to the family and friends on the passing of this individual, and we all share in your loss. We are seeing a gradual increase in cases in P.E.I. There's been a slight increase in the number of daily average cases in the last 7 days. Over the last 4 weeks, rates among individuals aged 19 and under have been decreasing. In the last 2 weeks, rates have been increasing in those aged 20 to 59 years of age, and rates in those aged 60 and over have been increasing since early March. In comparison, other jurisdictions are experiencing a much sharper increase in the number of new cases. The fact that we are not seeing exponential growth may be attributed to the gradual easing of public health measures and that masks remain mandatory in indoor public places, including schools. In terms of outbreaks, there are outbreaks in 11 community care and long-term care homes across the province. There's an ongoing outbreak at the Provincial Correctional Centre and a new outbreak at the Kings County Memorial Hospital. There are 34 childcare early learning centres with cases or outbreaks. 32 of these centres are open. 1 is open with modified or reduced capacity, and 1 is closed. In Canada, the BA.2 subvariant is now the dominant strain in many jurisdictions and is estimated to be 30% more contagious than the BA.1. To date, it does not appear the subvariant causes more serious illness. This subvariant was first detected in P.E.I. on March the 1st. We are sending fewer samples to the National Microbiology Lab for genetic sequencing, but of those most recent samples that have been returned, 36% of the positive samples were determined to be BA.2, with the remainder being the non-BA.2 Omicron variant. On average, we are conducting 850 COVID-19 tests per day at provincial testing clinics, plus an additional 200 per day at other locations, including hospitals. It's difficult to compare our rate of testing because other provinces are only reporting on PCR tests. And of course, we're reporting on our molecular-based testing. But per capita, we are testing 639 people per 100,000 population per day. Our percent positivity is 35%, which indicates there is widespread transmission of COVID-19 throughout the province. With the move to random testing, the number of tests conducted at the points of entry has decreased. Being up to date with our COVID-19 vaccines is the most important tool to protect ourselves, our loved ones, and our communities against the impact of COVID-19 resurgences. As I've mentioned before, immunity following a vaccine is a more robust, consistent, and predictable way to be protected compared to natural immunity acquired as a result of being infected with COVID-19. If you've had COVID-19, receiving a booster will improve your immune response and provide longer-lasting immunity. Individuals can receive a first, second, or third dose of vaccine 3 months after they were positive for COVID-19. Getting a booster dose when you are eligible is important. Receiving an mRNA booster offers superior protection compared to 2 doses, keeping more people out of hospital and preventing deaths. There is evidence that getting a booster dose reduces your risk of developing long COVID. I remain concerned about the 45,000 P.E.I. residents aged 12 and over who are eligible to receive their third dose of vaccine or booster and have not done so. As BA.2 transmission increases, it is even more important to get your booster if eligible, and especially if you are at higher risk for severe outcomes. Everyone who is eligible should receive a booster dose. Parents of unvaccinated children between the ages of 5 to 11 should make an appointment for their children to receive a first dose. Children are vulnerable to developing long COVID after a COVID infection. The long-term health impacts of these post-viral illnesses is not yet fully known. There is no shortage of vaccine appointments. There are over 1,300 appointments available in April, including some clinics, especially for children. Vaccine guidance will change as the characteristics of circulating COVID-19 variants evolve. Over time, eligibility for booster doses will vary based on individual factors. And in the next couple of days, we will be announcing a fourth dose for individuals in certain age groups and living conditions. And it will really launch a spring booster program. As in the past, we will follow the recommendation from the National Advisory Committee on Immunization. As outlined in the Moving On plan, like other provinces and territories, P.E.I. is transitioning from broad population-based protective measures to a situation whereby individuals are gradually making their own decisions regarding protecting themselves and others based on their personal risk assessment. Our individual assessments will impact decisions ranging from layers of protection, physical distancing, staying home when sick, mask wearing, hand washing, vaccination, to deciding to travel or attend events and personal and organized gatherings. As outlined in Step 3 of the Moving On plan, effective at 11:59 p.m. tonight, April 5th, the following changes will come into effect. As the Premier mentioned, the public health state of emergency will be lifted after being in place since March 2020. There will be no limits on personal or organized gatherings or sport and recreational activities. Wedding receptions, funeral receptions, and stand-up receptions will have no capacity limits. Businesses, including retail operations, gyms and fitness facilities, museums and libraries will be able to operate at full capacity. Food premises and licensed establishments will operate at full capacity. There will be no universal screening at the points of entry. COVID-19 testing will be voluntary at the Confederation Bridge until April 28th, at which time there will be no testing available to P.E.I. To people entering P.E.I. Between now and April 28th, incoming travelers will receive a COVID-19 handout and will be offered rapid antigen screening tests. Close contacts of positive cases are not required to self-isolate. However, close contacts, like all other residents of P.E.I. who develop symptoms of COVID-19, should continue to be tested at a health P.E.I. clinic and isolate until the results are available. And given close contacts will no longer be required to self-isolate, the Test to Stay program will be rescinded. Once lifted, the public health state of emergency will be replaced with an order under the Public Health Act that will be in place beginning tonight at 11:59 until April 28th, mandating the following. Individuals who test positive for COVID-19 will continue to be required to self-isolate. Those who are fully vaccinated, meaning 2 doses of an mRNA vaccine or 1 dose of Janssen, and children under the age of 5 years will be required to isolate for 7 days from the onset of symptoms or their positive test, whichever is shorter. Individuals over the age of 5 years who are not fully vaccinated will be required to isolate for 10 days from the onset of symptoms or the date of their positive test. Masks will be required in indoor public places until April 28th. I'll repeat this. Masks will continue to be required in indoor public places. In other words, we are not lifting the mask mandate at this time. Although not a legal requirement, it is strongly recommended that household close contacts who live, work, or access services in high-risk settings should be tested on day 4. This includes healthcare workers, first responders, long-term care and community care residents, members of First Nations communities, correctional staff and offenders, staff and residents of shelters and transition homes, staff and residents of mental health and addiction facilities. Students and staff in the K-12 system and in early learning childcare sector will continue to be asked to use rapid antigen screening tests 3 times per week for the next few weeks. Staff in long-term care and community care homes will continue to be screened before every shift using rapid antigen screening tests, regardless of their vaccine status. For long-term care and community care, the outbreak guidance is being reviewed and updated in P.E.I. and in many other jurisdictions. We anticipate being able to move to fewer restrictions on visitors and residents in the very short term. There will be questions regarding why the requirement to wear masks in indoor public places has been extended until later this month. We know that masks are an effective public health measure to reduce and slow the transmission. Masks do matter. We have mentioned previously on numerous occasions that masks will be one of the last measures to be lifted. The overall benefits of wearing a mask are greater when there is a universal requirement to do so. This is evident in schools and in the general public. We are prepared for an increase in new cases over the next few weeks as public health measures are gradually eased. The extent of this increase in cases and our own personal risk of getting COVID will depend on the number of close contacts we have, especially in indoor spaces, our vaccine status, and the spread of the BA.2 subvariant. Keeping the mask mandate in place for another few weeks will help curb transmission while we are slowly getting back to normal in terms of capacity limits and gatherings. Maintaining the mask mandate will prevent more people from contracting COVID-19 and prevent severe outcomes from this virus. We will not be wearing masks forever. However, during this transition period, it is important that we do the right thing and limit transmission of COVID-19 by continuing to wear masks in indoor public places. And I know lots of people have asked, how can we move more quickly to get across the finish line, which seems elusive at times. But wearing a mask in public places is a small sacrifice to make in order to protect those who are immunocompromised or those who are not yet vaccinated, such as our children under age 5. In conclusion, as we continue to transition to living with COVID-19, I'd like to leave you with 3 key messages. We are in a position as a province where we can transition and ease measures because of our collective efforts and support of public health measures. We are also fortunate to have access to safe and effective vaccines and treatments for COVID-19. We have a shared responsibility to continue using layers of protective measures to reduce the impact of COVID-19, including ensuring our vaccines are up to date, wearing a mask, staying home when sick, maintaining physical distance as much as possible. And just because some of these measures are not mandated, it does not mean we should stop taking these precautions. And finally, get your booster when eligible. Being fully immunized is the best protection against COVID-19 and its variants. And as we have finished every press conference in the last couple of years, and as we continue to transition away from mandatory public health measures to control COVID-19, let us be extra patient and kind on this journey. So thank you. And I'll open up for questions.
Well, thank you very much, Dr. Morrison, and I think we have others on the line as well, but do you want to start there? And since the Leafs won last night, we'll start with Dave Stewart from The Guardian.
Thank you, Mr. Premier. In light of the cases, Dr. Morrison and Mr. Premier, that you reported over the last several weeks, I think an awful lot of Islanders are concerned about whether we're moving too fast towards easing public restrictions. What is the message that you would convey to them?
I think, look, I understand that there would be apprehension, to be honest. I mean, This has been a 2-year journey with many ups and downs and a lot of emotional, baggage that we've all assembled because of this journey. So I understand that. I mean, all we can continue to say is that we base our decisions solely on the recommendations of the Chief Public Health Office and how they go about, accumulating that information, and what the information they relay to us has been consistent from the beginning. And I think that, I guess we've been critiqued for going too fast. If you check the correspondence in my office, it's largely around that we've gone too slow. So I understand there's some converging views across P.E.I. on this, but I really feel we've been consistent from the very beginning. We've tried to, we've started this journey by saying this will be about public health and not public relations. We've never delved into trying to figure out what is more popular or whatever. We've really just tried to make the best health decisions that we can make. And, in the lead up to this decision, it's been no different than anything else that Dr. Morrison meets with her table. They meet national tables, and they look at information from the province, the region, the country, and around the world. And that is what is put here to inform our decisions. But I understand fully the apprehension that might be out there. I know there's a lot of people that wish we could go faster, and I don't know how others in this chair would have done the job, but the only way I've known how to do this job is to make this solely about public health, and that's what these decisions are based on.
Dr. Morrison?
So I would agree. I mean, I certainly can understand and share some of that, and I know the Premier does, some of those concerns, but we've always said, too, that this is about balance. We are learning more and have to look at the unintended impacts of what we're doing and how do you balance that. And I think we have armed islanders throughout this pandemic with the best possible advice that we can. We have, given we have great vaccine access with a really good vaccine. We have now therapeutics that are available. We're distributing Paxlovid and able to connect people to Paxlovid in a way that is the envy of many other provinces. So we have put all that information together and are trying to make some really cautious but important steps forward.
You mentioned the mask mandate will be in place until April 28th. What is the plan for the school system? Will the mask mandate be staying in place for the remainder of the school system? What's happening there?
So the mask mandate will apply to schools until April 28th, and then there'll be further decisions, as the Premier mentioned, in certain settings. But I think at this point in time, it's important that the schools, I think, reflect what is going on in other indoor public places.
You mentioned a fourth vaccine. Do you anticipate that coming for the general public?
I anticipate the fourth dose booster will be recommended for certain age groups in Prince Edward Island and in certain living settings, for instance, long-term care and those over a certain age. But I think we'll probably be out maybe tomorrow or the next day, or release some information on that.
Thank you for taking our questions. I just wanted to clarify something about border screening. So I was just wondering, so it will be voluntary until the 28th, and will people still get take-home tests when they come through the border at that time?
Yes. So if at Borden, for instance, you'll be asked if you want to get tested with, and then you'll be directed into a line for that testing. And if you would like just to get information about if you get sick or have symptoms where you could get tested, that kind of information is in a handout, and you'll be offered antigen tests, 2 antigen tests to take. Those antigen tests and information sheets will also be available at the airport. And for those returning from the Magdalen Islands or coming to P.E.I. from the Magdalen Islands who are planning to stay in P.E.I., that same information and option for antigen tests will be given to them.
And What is our supply of rapid tests at this point in time? I know we've been getting deliveries periodically throughout the year, and I'm just interested to know how long we can expect those deliveries to happen, and how long those are going to be available to the public.
Well, certainly we've not had any indication from the federal government, who really we're getting most of our tests from, that is not going to continue. But I don't have the numbers in front of me, Brittany, of how many, but I know that it was reported to me yesterday about how many tests we had just received and how many we were expecting. So I know we certainly should be good for this month, and really wanting to make sure we have, of course, those rapid antigen tests available for those who might need them at schools.
What about access P.E.I. locations? Is the plan to continue having those available even past the 28th for people to pick up?
I believe so. I mean, we're looking at all the testing availability in terms of the testing clinics, and those who are at high risk who will continue need to be testing. And I know that is something that we're in conversation with Health P.E.I. about as well. But I would anticipate that there would be rapid antigen testing available, certainly through Access P.E.I. beyond the 28th.
And I'm curious to know a little more about schools past the 28th. If everything goes well until that point in time, what do you anticipate a school scenario or school to look like in terms of health measures and restrictions in place?
Well, I mean, I think right now we're going to be have some updated guidance out that's ready to go probably today or this afternoon to the schools related to some of these updated measures. So it will mean that some of the cohorting that's currently in place in the schools will not need to be happen in the same way. So and we have talked to the schools about that, or the public schools branch and the commission scolaire, and and it'll mean that assemblies may be able to happen in a different way in the next coming weeks, and but the testing will continue, the masking will continue, and I think that's really what our focus has been right now, Brittany, for the next few weeks.
I know in other jurisdictions, Alberta, Ontario, they're looking at sort of a next wave of COVID-19. You mentioned, a fall-winter wave, and I'm just curious to know, sort of as you're watching this, what your level of concern is, and what you imagine at this point that could look like here.
Well, I think we're all looking at some of that national data and those what we anticipate, not just later this spring, but in the fall, as you mentioned. And what is concern to us is if we have more COVID in the fall and into the winter, it will coincide with another respiratory virus season. So, so making sure that we, have vaccine access and booster recommendations will be really key. And some of these same measures will about staying home when you're sick, as basic as that sounds. And there may be, other advice coming, but I think we continue to try to manage and try to balance our way out of this COVID pandemic, but we talk about learning to live with COVID and not just with COVID, but with all our respiratory viruses as we go into the fall and winter.
And I just wanted to clarify one last point concerning isolation for close contacts. I just wanted to double check. So close household contacts no longer have to isolate?
As of midnight tonight. Now that, with the exception that if you're isolating with, I guess 2 points. So I'm glad you asked. So if you are a parent and your child is positive for COVID, your young child, you would be isolating with them. So and so that's important to remember. And if you're a household close contact, and you do not have to isolate it, but you have to make sure that the person who has COVID is truly isolating away from you. And that means that there's not the shared spaces and the ongoing contact, because as soon as that happens, then that person's not truly isolating. And so I think that's a challenge. But if you are truly isolating, someone's living in the attic or the basement, and the household contacts are asymptomatic, meaning they do not have symptoms, then they will not have to isolate. But again, our recommendation, if you live or work in those high-risk settings, you should get tested on day 4. And of course, as soon as you start to get symptoms, then you'd have to get tested and isolate.
All right, thank you so much.
Julien, bonjour.
Bonjour.
Comment ça va?
Bonjour.
Bien, et vous? Docteur Morrison, en français tout d'abord. Le masque reste obligatoire à Lille jusqu'au 28 avril. Pourquoi décidez-vous de prolonger cette obligation? Et au final, l'île du Prince-Édouard va être la province au pays qui va avoir le masque le plus longtemps.
Ouais. Alors oui, le masque reste obligatoire pour plusieurs semaines en avril. On sait qu'il y a plus d'évidence que ça réduit la transmission qui peut arriver. Et si c'est universel, obligatoire, c'est plus effectif que si c'est seulement recommandé. Il y a évidence, si les enfants à l'école portent les masques, ça réduit la transmission par 46%. Alors, et vraiment, tous les experts au pays pensent que c'est une bonne idée de rester les masques en place. Mais on pense que c'est la meilleure décision. En particulier parce qu'on est en transition avec les autres mesures. Et si c'est pas vraiment grand-chose qu'on peut faire et peut-être réduire le risque pour d'autres personnes et pour nous-mêmes aussi.
Pourquoi l'île du Prince-Édouard ne fait pas comme toutes les autres provinces au pays? À part le Québec qui a annoncé une prolongation jusqu'au 15 avril, tout le monde a enlevé le masque. Alors qu'on a tous les mêmes données finalement au pays. Pourquoi l'île du Prince-Édouard fait cavalier seul, entre guillemets? Pourquoi on est la seule à poursuivre dans cette direction?
Et puis vraiment, le premier ministre vient de mentionner, je pense que parce qu'on a fait ces mesures qui sont assez lentes, mais avec un peu de caution, qu'on n'a pas le grand nombre qui arrive. J'imagine que peut-être les autres provinces, quand ils voient le nombre de cas dans les derniers jours, vraiment, qui augmente tellement vite, ils aimeraient peut-être avoir les masques encore en place. Mais pour nous, c'est juste un autre pas qu'on fait. Et je pense que c'est la meilleure décision pour les insulaires ici à l'île du Prince-Édouard.
Après le 28 avril, le Premier ministre parlait tout à l'heure de plus forcément obligatoire, mais fortement recommandé, notamment à l'hôpital, dans les transports en commun. Est-ce que le masque pourrait rester en fait pour longtemps à l'île du Prince-Édouard? Est-ce que vous pourriez le rendre par exemple obligatoire à l'hôpital pour des mois et des mois, dans les transports publics pour des mois et des mois, mais plus obligatoire dans les centres d'achat ou les restaurants?
Oui, c'est possible. Et puis peut-être c'est the next step pour juste les faire obligatoires dans certaines places. Et puis, ça donne un bout de temps pour que vraiment les hôpitaux vont en faire leur même décision. Et puis, mais ça va pas continuer pour toujours, mais c'est pour maintenant, j'imagine, après le 28, c'est plutôt dans ça va être obligatoire seulement dans certaines sections comme les foyers à longue durée.
Parlons justement des hôpitaux. 30 personnes à l'hôpital avec la COVID-19. Si je ne me trompe pas, je pense que c'est le chiffre le plus élevé depuis le début de la pandémie. Ça se passe comment à l'hôpital? Est-ce qu'on est serré, juste? Est-ce qu'on est toujours correct?
Oui, la chose qui m'inquiète vraiment, les 3 personnes en ICU, il y en a plusieurs de ce grand nombre qui sont reliés à l'outbreak à Kings County. Alors, il y a seulement, c'est seulement 14 qui sont vraiment à l'hôpital parce qu'ils ont eu très malade avec COVID. Mais toujours le grand nombre, on fait attention et puis on suit ces nombres.
Dernière question. Vous levez toutes les restrictions à part le masque. Vous l'avez dit depuis longtemps, on va apprendre à vivre avec la COVID-19. Vous l'avez dit, vous vous attendez à une augmentation des cas parce que les mesures vont être levées. Mais finalement, est-ce que ça ne vous inquiète pas un peu de vous dire, on ouvre, il y a des gens qui vont avoir la COVID courte, mais il y a aussi des gens qui vont avoir la COVID longue. Est-ce que ça vous inquiète peut-être de réouvrir maintenant alors que les effets de la COVID longue, on en apprend de plus en plus tous les jours?
Oui, et puis j'ai mentionné ça en anglais. Ça m'inquiète et puis je sais que c'est une période d'inquiétude vraiment pour le premier ministre aussi, mais en fait, c'est une balance avec les autres impacts des mesures. On sait que d'évidence que ça peut réduire les chances d'avoir le long COVID. Alors, j'espère que c'est le cas. Et c'est aussi, on sait sait pas que si Omicron va avoir le même sorte de long COVID que les autres variants. On ne sait pas vraiment encore. On a beaucoup d'apprendre. Mais je ne sais pas si c'est toujours un temps parfait pour faire ces mesures ou réduire les mesures, mais on pense qu'on a vraiment les vaccins, on a les médecins pour donner comme le Paxlovid et on va garder les masques obligatoires pour maintenant.
Ask, but in English, do you have the numbers for the vaccination rates? You didn't give them today.
No, I didn't because I felt like we were doing here, but I do have them, and I bring all these papers for a reason. So we have 94.4% of those age 12 and up who are considered fully vaccinated with 2 doses, and 97.5% 12 and up have had 1 dose. We have 69.3% of those age 5 to 11 who've had 1 dose of the vaccine. And in terms of people who've had their 3rd dose booster, in terms of age group, we have 94% of those age 80 and above who've had their booster. 88% of those in their 70s have had their booster. 81% of those in their 60s have had their booster. 66% of those in their 50s. And 51% in their 40s. So just to...
Merci.
Okay.
Now we can go to someone who might have joined us online to ask some questions.
Gabrielle Drummond, Radio Canada. Good afternoon. Ma question en français pour la doctoresse de Morrison. Docteur Morrison, la levée du port du masque à Lille était prévue pour le 7 avril. Maintenant, on va prolonger ça. Est-ce que, en prenant cette décision, est-ce que vous avez peur de décourager les gens à chaque fois que vous reportez la ligne d'arrivée dans cette pandémie?
Bonjour Gabrielle. Non, je pense pas parce que je pense que les insulaires voient qu'on fait on annonce beaucoup de changements aujourd'hui avec les mesures et c'est vraiment les masques qui restent et je sais que les insulaires et le premier ministre vient de mentionner vont encore faire pour juste quelques semaines des décisions pour garder les masques pour protéger la communauté et ils ont fait ça depuis le début du pandémie et j'imagine qu'ils vont continuer d'en faire. Et je sais qu'il y a personne qui veut rendre malade quelqu'un d'autre, même si c'était pas parce qu'il voulait, c'était quelque chose. Il veut que personne ne devienne malade. Alors, je pense que on a fait beaucoup de décisions aussi qui sont plus avancées que les dates. On a changé les dates depuis la pandémie parce que c'est basé sur l'évidence avec la meilleure science qu'on a ici à l'île du Prince-Édouard et partout au pays.
OK, très bien. L'autre question, ce serait concernant les points de contrôle aux frontières. Je sais que vous l'avez expliqué en anglais, mais j'aimerais l'entendre en français, s'il vous plaît. Donc, comment ça va fonctionner, le dépistage au point de contrôle et si ça va être, comment ça va fonctionner et dans quelle mesure cette façon de fonctionner-là, elle va être effective, elle va prévenir que la COVID-19, des sous-variants, des variants rentrent dans la province.
On sait déjà qu'il y a COVID-19 qui est dans la communauté. Il y en a de transmission qui est vraiment dans la communauté. Alors, au point d'entrée, chaque personne va être donnée l'information à propos de COVID-19 et si on a des symptômes, il faut être testé. Et puis, ils vont offrir des tests, de rapid tests là-bas et pour prendre où ils vont être, il peut avoir un test, un molecular test juste aux frontières. Et on veut donner l'information vraiment même aux personnes qui rentrent ou retournent à l'île du Prince-Édouard qu'à tous les insulaires. Si vous êtes malade, vous devrez être testé. Il faut isoler si vous êtes malade avec COVID-19. Et puis, ça va, c'est important pour les visiteurs à l'île du Prince-Édouard et pour les insulaires qui viennent de retourner à l'île du Prince-Édouard.
Et ma troisième et dernière question, c'est concernant la 4e dose. Vous avez dit qu'il va y avoir un programme justement pour la vaccination de certains groupes d'insulaires qui vont recevoir cette 4e dose. Est-ce que vous prévoyez peut-être qu'au courant de l'année, ça va être étendu à d'autres groupes d'âge, à d'autres groupes d'insulaires, cette 4e dose-là?
Oui, on va suivre les recommandations de NACI et puis on essaie d'en faire ça depuis le début et puis on va continuer d'en faire et pour commencer, ça va être un 4e Spring Booster programme pour les personnes d'un certain âge et de certains où ils habitent dans certains comme les foyers de longue durée. Mais ça va être annoncé en plus détail, j'imagine, par demain.
OK, excellent. Merci beaucoup.
Okay.
Bonne journée.
Merci. Bonne journée.
Louise Martin, CBC. Hi, Dr. Morrison, Premier King. I hope you're feeling better. Dr. Morrison, I think you may have answered this in French, but I'll just ask for the English audience as well. The number of people in hospital at 30, how challenging is that for the hospital system? Are they able to cope with that? It seems like that's one of the highest numbers we've had. And then do you have a breakdown of the ages? Are you seeing more younger people being admitted?
Hi, Louise. So of the 30 individuals in hospital with COVID-19, 14 of them were admitted due to COVID, and including the 3 in the ICU, as I mentioned. We have a number of people of individuals who are related to the outbreak at Kings County Memorial Hospital. And these are some of the individuals who tested positive either on or after admission for other reasons. So at this point in time, the healthcare system is able to manage the numbers, but certainly we're always concerned with the number of people in hospital and watching that closely. There are no pediatric admissions in the hospital and have not been for a number of days.
Thank you. What about the positivity rate? You mentioned it's quite high. What does that tell you in terms of what's going on with community transmission, and how concerning is that number to you?
The percent positivity indicates there is widespread community transmission, and I mean, it's been a number of months. I think it feels like a couple of months that we've been saying that, you know, you should assume that COVID is present when you go places, and I think that that hasn't changed. It's just an indication that it is in our community. It's an indication we're really testing the right people as well, that those who are symptomatic are getting tested. I'm so pleased that we have testing access in this province the way we do, and that we can track our percent positivity using the testing that we have.
So there's no immediate plans to end the bigger, larger testing clinic sites?
Certainly, we've also asked Health P.E.I. that we, given the rate of illness in the community and the rate of circulating COVID-19, that we would continue those testing clinics throughout April, and then we'll continue to have discussions and look at what's happening in the community. At some point, testing will be moved to those who are more high risk for severe outcomes. But at this point, there's no change in terms of who should be tested at our testing clinics.
And in terms of the new variant, you know, the BA.2, does that mean that getting COVID, or if you've had it, does it still give you any amount of immunity for any amount of time? You know, we're often said, I think it was the 90-day period where you shouldn't be retested.
Yes, that continues. So regardless of BA1 or BA2, the advice is not to get retested for a period of 3 months. But
Okay,
and if you haven't had your booster, after 3 months, you should get a booster to provide that longer immunity.
Right, but you should wait that 3 months.
Yes.
If you've had COVID, okay.
Yeah.
And my last question is for Premier King. And again, I'm nice to see you in person. I hope you're feeling better, Premier King. You know, you're never going to make everybody happy, right? You're going to have people who are both happy and sad with today's announcement. But how do you bridge that gap, so to speak, when it comes to bringing people around to really what is a new reality?
Well, thanks, Louise. I feel much better than I did this time last week. I don't know if I'm 100%. I'm still a little winded when I walk any length of time, but coming around. So I appreciate you asking. I think the first thing I learned on the first day I took the job was that you can't make everybody happy, and you shouldn't even try. And that has continued throughout what has been close to 3 years in the job. I think Islanders all have their views. They're very well informed on all issues related to politics in P.E.I., and they have many, many venues and opportunities to share those thoughts, and they should. But my job is essentially to try to do the very best that we can for 160,000 people. And in doing that, you always know that it will find favor with some and find flaw with others. And I think as long as there's democracy in this province for the next 3,000 years or longer, that will always be the case. And I don't mean to be flippant in it, but I don't spend much or any time really worrying about the public opinion of it. I've tried to be consistent. The one commitment I made to Dr. Morrison on the very first meeting that we had was that this would be about health. We wouldn't let public relations or public opinion or the suggestion of what is best or what most people like weigh in, and it hasn't. I think Dr. Morrison would echo that comment. And but overall, I want Islanders to know that we understand not everybody loves a lot of these protocols. I look at your colleagues in here; they're all wearing masks here. I'm sure they don't love it, but it's part of the routine right now, and they're doing it for a reason. And I think Islanders have taken that approach. And I just would continue to ask Islanders for. They've shown tremendous patience and resilience, and if we could do that for a couple of more weeks, it will be in our rearview mirror here at some point. But I mean, COVID is with us. COVID will continue to be with us, and you know, this is part of the journey we're on now, and none of that changes whether we like it or not. We just have to deal with the reality, and that's what Dr. Morrison and I try to do every day. So.
All right. Thank you both very much. I know you have to get to the legislature, Premier.
I don't have to, but I guess I'm responsible to get there. But I do appreciate your asking, and thank all of your colleagues for. I love the legislature, just to be clear. So, but thank you to Dr. Morrison and to everyone who've joined today, and just continue to be safe. So, thanks.